October is Breast Cancer Awareness Month. More than 331,000 new cases will be diagnosed just this year, according to the American Cancer Society.
There are several things you can do to lower your risk. Medical lifestyle expert Dr. Eudene Harry is here with some tips to help us all stay healthy. Thanks so much for being here.
Thank you for having me.
Let's talk diet, plant-based diet. That's what we're talking about here.
Right. So we're talking about plant-based diet and things to avoid. I think the key thing is that we need to know that saturated fats and processed foods have been linked with a higher risk of breast cancer. And while we can't prove causation, anything that's linked to a higher risk of breast cancer is something that I want to be concerned about.
You were just telling me right before we went on that a lot of women don't think about diet when it comes to preventing breast cancer.
Right. A lot of us don't think about diet. We think about diet for heart disease, which is really important. We think about diet for brain health, but we're not thinking about diet for prevention of breast cancer when there are many studies coming out that's telling us that certain foods like the dark leafy vegetables and the cruciferous vegetables and polyunsaturated fats really go a long way towards helping us to prevent the disease.
So you want to do berries too, like you were saying?
Berries as well, because berries has a special component in it that's actually been shown to help reduce risk of estrogen receptor positive cancers. And so these are nice things to look at to know that we can get in diet. And nobody is by any stretch saying that you will never get cancer if you eat this way, but it's just saying that, you know, this is something that we can start taking control of ourselves.
And I know your background is in holistic medicine, and so you're really, this is all top of mind for you. How much of these foods should you incorporate on a daily, weekly basis, whatever?
Well, as much as possible. And I think even when you look at our plates or what we're supposed to be eating, like 3/4 of that should be fruits and vegetables. And many of us don't actually incorporate that as a
three-quarters of it.
Maybe throw it into a smoothie.
Throw it into a smoothie, right?
Right, exactly. And then there's some other tips to try to prevent breast cancer, including exercise.
Oh, exercise is a big one because that's actually been shown to reduce your risk of breast cancer, and it might be working in several ways. It might help our insulin to work better, and we know that high insulin levels have been linked with increased risk of breast cancer. And breast cancer might also help us to metabolize our estrogen levels a little bit better and help us to keep a healthier weight, because we know increased weight has also been linked with an increased risk of breast cancer.
What about on a daily, basis with the exercise? How many minutes a day would you recommend for people? I know we're talking about yoga, we're talking about CrossFit, HIIT workouts. What's the recommended daily?
So the recommended daily, and I'll say weekly, is 150 minutes a week. I say anything you can do, just keep moving. Because for me, I think 20 to 30 minutes, if you do 20 to 30 minutes a day, and you don't have to think I have to go to the gym or anything like that. You can do this at home. You can go walking with your friends. Just keep moving, because we all know when we stop, it's difficult to get moving again.
And it's really just all about having a healthy diet, healthy exercise, limiting alcohol.
Limiting alcohol is a big one as well, because heavy alcohol consumption has been linked with increased risk of breast cancer as well.
What about supplements?
Supplements, we are really in an interesting time where we're starting to study these things. The extract of broccoli, which is one of the things we talked about before, has been looked at, and it was a very small study, 54 women with breast cancer, but it seems to actually turn on the genes that can suppress breast cancer. So while we're not saying that this will cure anything, what I hope it does is encourage you to continue to eat well.
Thank you so much for coming in. We appreciate it.
Thank you for having me.
Breast cancer.
Yes.
Would you like the pink?
Lots of food for thought. Thank you, Doctor. We appreciate it. And we will post all of her tips for preventing breast cancer on our website, cbsnewyork.com.